guys, Michelle here from Supply with our continuing series on how to apply and use our medical products. Hey guys, today we're going to discuss how to apply the shoulder pad for the Breg Polar Care systems. This applies for the Cube and Kodiak system, and it's the same application for the regular and the XL shoulder pad. Now, the way to determine which one you need: if you're below 42 inches around your chest, it's suggested that you get the regular. If you're above that, you should get the XL. And it's the same for men and women.
So when you get your pad in the mail, the first thing you want to do is check the part number. Again, the pads are not interchangeable between the Kodiak and the Cube. They will not work on each other's systems. So check that. And if you notice, this bag is sealed. Once this bag is opened, it cannot be returned. We sell to mostly surgery patients, and these bags have to remain sealed when they go out to the patients.
Along with your pad, there's going to be a paper just reminding you to make sure that you did in fact order the correct pad, and it'll show you that the connections are different. There's also going to be a QR code that you can scan, which will take you to our YouTube channel, where we would love it if you would subscribe so you can see all of our videos and allow us to post more videos for you.
Another really important point, and you'll get a flyer with your system or your pad, is you're going to get a skin warning label. Never put this pad directly on your skin. It could cause harm. So the universal protocol for ice is 20 minutes on and 20 minutes off. As always, please check with your physician to make sure what works for you.
We do sell sterile dressings, and there is one for each pad. These provide a barrier between your skin and the pad, and they do come sealed as well. Once you take this out of the sealed package, you stick it inside your pad, and every time you go to apply it, your barrier is already in place. Now, we're going to show you how to apply the pad. Now that you've made sure that you have the correct pad for your system, you're ready to apply it. So today, we're using the regular shoulder pad for the Cube system, part number 04900. As you'll see, the pad is numbered 1, 2, and 3. The straps that come with it are also going to be numbered. So you're going to apply the correct numbered strap to the number on the pad. So we're going to go ahead and attach our straps to our pad so we can get ready to apply it. We're going to put the number 3 on the number 3 spot, number 2 on the number 2 spot, and the number 1 on the number 1 spot. Then, once you've done that, if you're going to use a barrier, you're going to want to apply your barrier next before you put it on your skin.
You can also use a t-shirt or a thin towel. We do sell the sterile pads, so please check down in the comment section for all the part numbers for all the particular pads and sterile pads.
Now, if you're going to be using a sterile dressing, you're going to need to remove the tabs on the underside of the dressing. Once you've done that, you're ready to stick it inside the pad, and just make sure that you cover the entirety of the pad so that no part of it is touching your skin. Once you've done that, you're ready to apply it. Now, I'm going to start with the number 3 strap, which comes under the arm. That one can be a little tough sometimes. And as you can see, we pulled it under and I attached it to the number 3 spot. Next, I'm going to bring around the number 2 one and attach it to that spot. And then finally, I'm going to take the number 1, which if you can hand it to the patient and have them bring it around, that's convenient. If not, you can walk around and attach it yourself. Now, once these are in place, you can always adjust them if you need it a little bit looser or a little bit tighter. Once the pad's in place, you need to get your cooler ready. So in our situation, we're going to use the freezer bags. And you can find these on our website. They take the place of ice cubes. You're basically making blocks of ice. They keep the water colder and they stay frozen longer, so you don't have to change the water out as often. And you can fit 3 in the cooler at a time. So we're going to place our freezer bags in the cooler. Then you're going to fill the water to the water line. Replace the lid, lock it in place. Then you're ready to connect your hoses. Now, before you connect this, you need to press down these 2 little metal tabs. And this is on the hose coming off of the cooler. Once you've done that, you can connect the hose from the pad into the hose from the cooler. You'll hear that little click. That means it's fastened properly. Next, you'll plug in your power supply, which is going to plug into the back of the lid, and then you'll plug it into the wall, and you're ready to go. And keep in mind, unless your doctor has told you otherwise, 20 minutes on and 20 minutes off is the rule of thumb. Thanks for following, and as always, if you have any questions or concerns, shoot us an email at cs@supplypt.com or give us a call at 1-844-505-8144, Monday through Friday between the hours of 8 a.m. and 4 p.m. Eastern Time.